Hi, welcome. Thanks for joining us today. We're here to talk about micro centers. This is a very exploratory conversation. I want to preview that. So we're excited to have you here engaged, hopefully for some robust discussion. I'm Bevin Parker-Cerkez. I'm a senior program officer at Local Initiative Support Corporation. I'm joined by Katie Harbison from the Chambliss Center and Louise Stoney, who's obviously head convener at this party today. So today we're going to sort of dive in, once we get the slides working, into some just context, talk through some definitions, again, still in learning and exploratory framework, then talk about what this may look like in practice, and hear from Katie and what she's doing in Tennessee. And then Louise is going to guide us through sort of some promising practices, discussion-based conversation around what this could look like sort of at a larger scale. So all right, I'm glad. Oh my God,
Yay.
Here we go.
Yay! Okay.
Great. And any questions, feel free to use that.
Okay, great. Thank you. All right. So here we are. Again, I'm Bevin. I'm from Local Initiative Support Corporation. We are I'm just going to do this really quickly. Sorry. We are a largest community development financial institution in the country. And so that's essentially a nonprofit bank. The reason I'm here and care about this issue is early childhood education is core to our activity of building up communities and providing strength. Historically, many CDFIs sort of deal in the world of lending activity, and that really revolves around facilities and infrastructure. And so this conversation is really interesting to us as we consider ways to support communities and new opportunities and innovations in space, but also thinking about the complexities of early childhood and how that can all sort of come together in a way that benefits families, providers, and all of us in communities at large. So what is a micro center? This is not a new sort of concept. We've probably seen this around for several years, decades even. But really, I think a little bit of this today is sort of naming what this is and starting to think about how we can sort of pull it apart, where we've seen it, where we want it to go, right? And so at its core, we're really talking about a one classroom site that receives sort of support in both sort of programmatic components, but also operations and systems and administration from an offsite entity, okay? And so really these, in practice, these are looking very different depending on local regulation and licensing. But again, it's sort of looking fundamentally at a space that we hope will create high quality programming for children and families that is accessible. And accessible, I mean accessible to both private paying clients and those children and families receiving and relying on income-based subsidy. And that we really have the opportunity to think about some of these sites as individual and more sort of smaller scale, right? So when we talk about this offsite entity, right, thing that's supporting the backbone of some of the activity of this site, we can call it, Louise through Opportunities Exchange paper has called it a network hub, right? And so these hubs can be lots of things, but they also have some again core sort of activities that we're relying upon, right? And so really we're lumping these into two sort of categories, thinking about the program and pedagogical sort of aspects that they're supporting, which could be staffing, hiring, professional development and supports, curriculum, assessments, supervision, and then the operations and administrative pieces. So singular enrollment, billing, dealing with licensing, quality rating improvement systems, budgeting, fiscal management. And so really, again, we have this at its core, this hub. We have the activities or the individual sites that can be in a multiple different sort of infrastructure facility spaces. But again, the hub is creating sort of this backbone. What we all are exploring too is how do we get to a place where we're realizing some economies of scale, right? So when does it make sense to have how many hubs or one core hub and then how many sort of sites that are sort of paying into this like backbone system, right? Please give me 1 second. So that's sort of the hub, and we've seen the hub can look like lots of different ways. Maybe CCR and Rs can fulfill this role, school districts. Katie's going to talk a little bit about the way the system is set up there. And that's likely, again, going to sort of conform to the nuance and local geography of what's happening in the space, right? So from an infrastructure perspective, what do these locations or physical spaces need to look like? Again, we want to think about affordability and accessibility for families. So the opportunity to have these smaller sites maybe means that we're putting them in places where there's more acute deserts, right? We don't always think of, I think historically we think of the desert as this large swath of places that, there's lots of children and nothing there. But we have these more acute individual spaces that are really needing more service and more aligned and direct service, right? And so could these go into schools, federally qualified health centers, any social service entity or organization where families are sort of tracking or going to, employment centers, small employment centers, right? And so thinking about these scale issues, co-working spaces, a lot of the other components that we've heard of more. So we have these like sort of coming out of COVID, we have families that have more diverse needs in terms of when they need care and where they need care. So is this an opportunity for us to sort of think about where we could be more distinctly placing these, again, so that families can access them earlier and easier? Could this also be a way to think about solving for deserts and rural communities where we don't have hundreds of children sort of needing a 50+ child site? So again, thinking about sort of the identification of where families are, what their current needs are, where they're sort of already traveling to, and how we can consider spaces within the context of that. So what do we need from these spaces in order to really think and utilize, again, those economies of scale? So we think about spaces that maybe offer reduced cost to a childcare operator, right? And so thinking about that through the fixed costs for rent, sort of maintenance, janitorial pieces, ongoing maintenance activities, and then build out, right? And so can these sort of entities help support the initial build out or financing facility components, furniture, fixtures, equipment, those pieces, right? Anything at a reduced cost is going to help the operating model overall. And how do we think about sort of the landlord and tenant relationship as it equates to this? I think, when we think of social services, we think those mission pieces are really aligned. And so that's a really great opportunity for us to consider sort of communication, collaboration, and partnership between these landlord entities and then the operators contained within. So what would a great micro center look like, right? There's some fundamental core things that we want to see from any space for childcare, right? Well-paid staff. We want, high quality education, folks, from an operating model perspective, receiving the full cost of care. But then what other components can we think of? So again, we sort of want these healthy, safe spaces. But then there's this business model that actually works. And I know we know this, we heard it this morning, right? The big elephant in the room is like the business model just doesn't work because the system is underfunded. So that aside, which we all can recognize, thinking about the micro center piece, we can't sort of set that aside. We have to think about, and to be honest and frank, this is sort of a way to consider a rate of cost reduction, right? And so this is a way to think and sort of solve for the pressing issue of just a fundamental underfunded system. So, but at the same time, again, can we offer these spaces that are offering high quality components for families? So we have, again, this accessibility piece, and then thinking about services that are available to unique needs, right? And so if we think of these smaller scale entities, can they be sort of more conforming to a specific set of needs of children and families within a community? Are there any others that panelists would like to see, that audience members can think of that we could add into this list? So what are our opportunities, right? Again, we think about the pressing need to really think about the profitability and financial model of this. Nobody wants to support an operator into an activity that's going to be, losing money year after year. And so, is there a way we can sort of systematize this and think about how we can really reduce the overhead and of some of these sort of infrastructure and facility pieces, and then share some of the expense costs that allow us some room to really put money into salary, to put money into sort of quality pieces that we really want to see through the programming and activities. And are these spaces that are small enough, they're able to really truly fit sort of family needs of a very local community. We can also think about these as really great growth opportunities for home-based childcare operators, right? If they want to grow beyond just a family childcare setting, this could be a really great next step. And then again, we have these sort of coming out of COVID, we have lots of sort of underutilized commercial spaces, commercial corridors with nothing in them, right? There's a lot of landlords looking for tenants right now. And so is this an opportunity to seize some below market rents, to really think about, again, sort of regenerating communities and how to support families contained within. Again, I think we all have been hearing, and we really want to think about the employer's responsibility contained within the childcare system. And so is this another way to sort of co-locate with a large employer who's just sort of recently interested in supporting childcare? Maybe these small centers could be spaces for them to sort of, test the waters, get an understanding of how this would work by supporting these small offsites. So what are our challenges? Again, as we know, the complexity of the system, licensing, regulation is different everywhere. But again, we are constantly going to run up into this. If we're treating these micro centers as actual centers, we're going to run into the conforming of space that needs to happen. I don't think any of us want to see an unhealthy or an unsafe space. So how can we sort of deal with the tension of creating these quality safe spaces while sort of unpacking and understanding what we really need to see in terms of requirements from licensing, from quality rating and improvement systems. And that's really going to fold into so many things, not just from an infrastructure perspective, but also thinking about ratios, right? Who's on site and when, and all of these things that, add cost to the operating models themselves. But if we think about how we can sort of employ these network hubs to serve and support some of these additional components, and then really think about this economies of scale in order to really offset the costs, is a way to really get through this. So in terms of our exploration, we're going through and thinking about, sorry, I can't really see where, so what states sort of generally are allowing for this? Where are we seeing these things? How can we sort of think about the proposition of potentially new licensing or regulation to conform to this? How would QRIS sort of work within the context of this? How do we ensure that we're still creating these healthy, quality, safe spaces? And then what can we sort of learn from home-based childcare operators? I know many of us are in states where we have homes, but we have expanded homes or groups. Sometimes those need to be in residential settings. Sometimes they can be in commercial settings, right? And so what is the sort of contextual crosswalk between those? And who's doing this well, and what can we learn from them? And with that, I'd like Katie to go through and tell us a little bit about what she's doing. Thanks.
Okay, so I'm Katie Harbison at Chambliss Center for Children in Chattanooga, Tennessee, and just a little bit of history. Our organization's been around for 150 years. We do residential care, we do child care. Phil Akeford was our president CEO for 50 years, and he never said no to anything. So that's why we are here doing what we do today. And about 20 years ago, somebody came to Phil and said, hey, could you locate a childcare program in one of our schools? And Phil was like, sure. So here we are today. They're now called micro centers, thanks to Louise. We have called them our school sites for a couple of decades. So you might hear me say that. I will try to say micro centers, but to us, they're just our school-based programs. So really what we have is a network of childcare centers or programs, one classroom centers located inside of our county school system. So we operate inside of 12 of the schools, and each of those programs is licensed as in our state as a family group home. So it is not licensed as a child care center. It's licensed like somebody who's doing childcare inside of their home would be licensed for up to 12 children. So each of them have a different provider number. We have to do things 12 times for everything, which is kind of the pain of it. But there really is a network of folks that are all doing the same thing that has really developed this nice cohort of folks. But you can see how we are kind of aligned or formed in terms of a staffing structure. I do have a director of the school-based programs, and so she oversees all of them. She does everything from moral support to managing waiting lists, because we do have a lot of folks that work inside of the school system that need childcare, and either their school doesn't have a program or their school's program is full. And so anytime we get emails or inquiries about the school-based programs, we send them to her. And then she says, well, we don't have a spot here, but we do have a spot over here. And so she'll kind of help. And then she'll do the handoff to that other school who does the enrollment. She helps with everything, getting them prepared for licensing, which is sometimes very scary when they're doing any sort of accreditation or any question they have about curriculum. I mean, she's basically their go-to person. She's texted me now about fingerprint clearances. So, you know, she's basically their point of contact. We also have at each site a lead teacher. So at each site, there is one kind of person in charge, and they are the ones who manage, we use ProCare. So we have ProCare on all those sites. They're the ones that manage enrollments in ProCare. They're the ones that turn payroll into us. They're the point person for that site. They schedule staff to make sure we're covered. They communicate typically to the parents. So that lead teacher has a lot of responsibility for that site because they're the face of that program most of the time. Then, of course, we have other staff members that report to that lead teacher in that program who might be full-time. Some of them might be part-time. It just depends. We also have another kind of key person, which isn't actually employed by us, which we call the teacher liaison. And that teacher liaison is actually a teacher in the school system. And the language gets a little crazy because we call our teachers teachers, but our parents are also teachers. And because the parents of the children in our program are teachers in the school system. So I'm sorry, it's very confusing. I think I put on here school liaison just to keep it a little bit easier, but basically one of the parents in our program serves as the liaison to the other parents in the program. She happens to typically be a teacher in that school as well. And that person is really key into communicating things like when they're going to be open or when they're going to be closed, but they also they have a lot of responsibility around hiring and setting up the salaries for our teachers. And so right now, all of these sites, all 12 sites, can set their own pay rates. Just a spoiler, I'm probably changing that soon because some of these sites need to pay more than they pay. So starting in August, they don't know this yet, but there will be a floor. You can't pay less than this or you will not keep staff. But that's a different topic for a different day. But right now, they all set the hourly rates for all of their teachers, the lead teacher and everyone else. And so there is some tension there sometimes because they don't want to pay more. Who wants to voluntarily pay more for childcare every week? And so there's a lot of tension there. So that teacher liaison position, that school liaison, is really there to help communicate and help the other parents sometimes understand why rates go up. So that's really how it's structured. I will say one of the, actually I need to advance.
Oh, yes,
If you'll advance me.
Oh, yeah, here we go.
One of the things or lots of great things about this model that we've seen, and it would probably be in more schools if the schools have room. So kind of the way this process goes is the schools, usually what happens is a principal says, I have 5 pregnant teachers and they're all going to need childcare, and childcare is already so very hard to find. And one of the things they want to do is to keep those teachers in their school. And that really goes back to the way this program started, is that the school system was seeing all these great young energetic teachers leaving the profession. And it was mainly because they had babies and wanted to stay home with their child. So being able to locate this classroom inside of the school, right down the hallway from this new mom who can come check on her child, go nurse her child, whatever, whatever it needs to be, it really, really has increased teacher retention. And a lot of the principals also say it's one of their best recruitment tools, because they can say, come to our school. We have a childcare program here, and it's just for teachers and staff in the school, and we'll make sure that you get a spot. So that's really how it started, and it has really just continued to grow, continued to be a huge source of benefit to those schools. One of the things that Bevin touched on, and we can talk a little bit more about this, is the licensing issue of it. This is very tricky because we are licensed by the Department of Human Services. We are located inside of a building that's licensed by the Department of Education. It's very weird. And it's an interesting concept, and your licensing folks have to be willing to license a family group home that's not in a residential setting. And some aren't able to do that. But I will say, some of it is interpretation. Some of it is actual rules or laws, and some of it is interpretation. If you look at other areas in Tennessee, they have had trouble doing what we've done. We all have the same rules. It's just been interpreted differently. So I would challenge you, if you're thinking about this, to actually look at what your rules are and to challenge whether or not it actually has to be licensed inside of a home. Just a side note, we actually license another program that is a family group home that is not inside the school system. We work with a nonprofit in Chattanooga who they serve single moms who are trying to finish their college degree. And they have what they call Scholar Village, where all these moms live together and they kind of develop this community and they provide support. And they came to us and said, we would like for you to provide childcare for these moms so that we could help them go to school and continue and go to work and complete their college degree. And so we have actually licensed, it is actually in a house, but no one lives in the house. So it's kind of complicated, but they lease a house in Scholar Village that is their office. And so the front part of it, has their offices and some meeting space, and there's a kitchen. But the back part of it, there are 2 rooms that we actually license as a family group home for them and operate it for them. Again, it's in a house, it's in a residential neighborhood, but our licensing people had to be willing to say, yes, we can license this even though nobody lives here. And there was a question about it at one point, and I was like, no. We license all these others in the schools and you let us do it here. And so then magically the rule disappeared and we could license it. So there is a way to do this outside of even the school system, I guess is what I'm saying. But anyway, licensing has to be on board with it. And I think that relationships with your licensing people are definitely key. Let's see. Let me go down. I mean, you can see all the different ways and the things that we provide for, these are all the things that we provide for these sites. Everything really happens on our hub, back at the main campus. We have the staff there that are doing their payroll. We're processing HR paperwork. We're the ones that are submitting for the grants that have come out for them. We're the ones submitting attendance for their, if they have any children on certificate. So really, the only thing that happens there at that site is the enrollment and the collection of fees. In terms of business stuff, of course, they're taking care of children there. But really, everything that we can do at the main campus, we do, really just to allow them, because there's nobody there at those sites that is just an administrative person. They're all hands-on, they all have kids with them all the time. And the rooms are set up, just think of a large classroom in a school where there is a divider of some sort down the middle, typically bookshelves. Sometimes it's a more permanent divider. But young children are on one side of that divider and the older children are on the other side of that divider, just to kind of give you all a picture. And these are 0 to 5. So all of these programs take children from 6 weeks old up to 5 years old. So I will stop there. And do we want to do questions now or we'll just go on to Louise?
Yeah, let me go on.
Okay.
Next slide. Can you advance
Yep.
the slides? There we go. So we're gonna have questions in just a few minutes, but we want to give you a 360 view because this is a complicated issue. Bevin started out by talking about both the need for it, but the messiness of it, right? We're really inventing something that's new. We are talking about a single site childcare quote center, because it's not in a home, with just teachers on site and with a director offsite who's overseeing it, right? And with leadership offsite. So this doesn't really fit. It's not really a childcare center. It's not really a family childcare home. It's this weird new thing. And what we want to do is embrace that. We want to embrace that innovation. And we want to say, how do we, as a movement, embrace this and move forward? So I think there's this is a really important public policy issue. And I want to underscore a statistic that I literally just found. I added this like 2 days ago.
We
They haven't even
this
seen
slide.
this. But I thought it blew my mind. Do you know that between 2012 and 2019, the number of childcare centers that serve fewer than 25 children declined by over 28%. So we all talk about the decline of family childcare, but the reality is we're talking about the decline of any small setting. And why is that? So obviously finance is a big thing, right? There's economies of scale in order to be able to afford teachers. But guess what? A significant part of that cost is administrative cost. If you can take that administrative cost and scale it big time like they are and drive your costs into the classroom where you're just having 2 teachers, you really, and we can show you numbers. Like we've run the numbers on this. The cost per child is significantly lower without compromising quality if you can get over your hang up that a director has to be on site. And so this is a really promising model. So, you need to do that. Sorry, not me. So what do we do at OppEx that's so cool? We basically say, we got this big vision. Now, where can we start, right? And where we can start is states where you have wiggle room. And so I've actually pulled out all the regs. So here are 7 states that allow family childcare to operate in a non-residential setting. In other words, there's nothing in the law that says you have to be in a home. So in those states, you've got a window of opportunity. There are 8 states that have that for group family childcare. So, and some of these are, you see the same states, but look around, right? So in Tennessee, you can't do this if you have fewer than 6 children, but you can do it for group, right? So again, if you are in one of these states, you have an opportunity to do this. You have to say it's licensed as a family childcare. Yes, it's messy. It means you have to have 12 licenses for each classroom. But a lot of that can be scaled and that leadership can happen. Now, there are at least 14 states that have crafted some strategies that public pre-K can happen in home-based childcare settings. And what you see highlighted in blue are the ones that also allow you to be a micro center. So bingo, that's another opportunity if you're in one of those states. So you see how my mind works here, right? Where are the doorways that we can walk through now as we're trying to build a case for creating new categories of care? Because we all know that changing licensing laws takes years. But so let's jump through where we have opportunities and let's move forward. Next slide. So now we've got one state, Tennessee, which is super exciting. There was Blair in the room here.
We've got some other Tennessee.
Oh, yay. So in Tennessee, they're launching a bold new experiment, and they're actually going to see if we can create some statewide energy around micro centers. And there's leaders basically looking at getting state funding to do startups all across the state in different regions. So this is super exciting because if we can begin to build that kind of capacity, we can basically have a state that says, hey, this is a category of care we really want to endorse. This is a place where we want to go. So I just wanted to throw that out so that you began to see the messiness, the opportunity, the bigger policy issues. And now actually, let's just have a conversation about what do you guys need to know to move forward, and what else should we be putting on the table?
I was gonna add one thing too that I forgot
sure.
to say is how much, this is basically for us an employer sponsored childcare, because the Hamilton County school system is giving us the space. They provide all the janitorial. They are paying all of the, utilities in that room. There are even some supplies. They're in charge of the table and the jobs. So this is basically a way for us to reduce the cost of what it's costing us to provide the service. And our expenses really just come down to the salaries of both a portion of that director. So we take the director's salary divided by 12, and that's what you're getting in their salary, in how much they have to cover. The salaries of those staff on site, and then other things are super minor. Liability insurance, super inexpensive for that size of a program. And then a per day license, which is so. I mean, that's it. That's it for costs, and that's how we can make it affordable.
You can advance the next slide. And then we'll, yeah, go ahead. Oh, yeah. Oh, sorry. Next slide after that. Yeah. I already talked about
We
that.
already talked
Yeah,
about the
yeah,
elephant.
yeah. We already talked about the elephant in the room. Yeah. So go ahead. Yeah. So Shannon, you had a question. Go.
Hold on.
Wait 1 sec. We're going to give you a mic because we want the people on Zoom to be able to hear you. Yeah. So we're going to bring you a mic.
Hello? Yeah, okay.
So I was just thinking about some of the real estate investing that is emerging in the childcare space and the potential for co-locating micro centers as a potential efficiency, really like having those hub supports right there, and whether there's been any movement in any state around that idea. Or maybe we'll.
Bevin's the person. Yeah.
Sorry. So at LISC, we're sort of testing this theory by supporting a lot of pre-development activity for co-location of childcare with other developments, right? And so as a community development financial institution, how can we embed these within other economic activities, right? And so we put out a call to our national teams, and we onboarded 10 sites across the country. We thought we'd see a lot more micro centers that would really sort of, we've got about 1 to 2 that are sort of looking at this, right? And so one is sort of co-located on a medical campus, again, really connected to this employer sponsor model, thinking about those pieces. And then we had one that's sort of exploring through this co-working space, so sort of a drop-in piece. That had been really working and actually fell out of the group just because the licensing had been such a critical issue for them that they just sort of found a loophole. They're going to run it, sort of separately and aside. So they're still working through sort of how to like proliferate that and get it really into an integrated model. But we also are seeing some within the context of housing, affordable housing development. And so that's been a really great one that we think has real legs because we have a full resident population, right? That's sort of on site. You have a lot more affordable housing that's looking like first floor sort of, these are mixed developments now, right? We have first floor anchor tenants, commercial spaces. We're talking about sort of one classroom. That's only a component, but it's diversifying revenue from affordable housing developers. And so getting these folks at the table, talking about this, these are some of the folks that have not been in the childcare conversations historically, but I do think there's real room to talk with folks that are sort of mission, again, thinking about nonprofit developers, mission aligned developers to get them within the conversation because they get that that's an important, in the instance of housing, right? They want their tenants to stay there. They want them to feel like they have accommodations. amenities, right, contained within. And if they're reducing sort of turnover of their own resident population by providing childcare within the context, then everybody's winning, right? And so I think that's another piece of this, the developer piece, but also thinking about how to talk through and get those employers on board and understanding that this is they need to get involved in this.
Yeah, Shannon, let me build on that and say too that I feel like there's absolutely a role that a wide variety of these real estate companies or variety of sponsors can. It's incumbent on us to create a framework that they can see, oh, okay, I play this role and here's my responsibility. You play this role and this is your responsibility. Here's how the budget works out. And that's part of what I think we need to start working on is how do we package this? And we tried to explain in our handouts how Chambliss does it. But I think one of the things we're going to find out as we grow this is what a different ways of dividing up roles and responsibilities look like.
Yeah, they think, oh, sorry.
No, I was just gonna add that I think one of the things that is going to make a micro center successful is that you need a host that wants you enough that you're not paying rent. I would say, don't look for somebody with reduced rent, look for somebody with no rent.
Yes.
Because they need you just as much as, well, they need you more than you need them, I guess is what I want to say, because you need them to want you there so that you are not having to pay any rent at all. I would say you start paying rent and your ability to pay your staff well goes down pretty significantly. So I would say, look for a place that is going to offer you free space and hopefully free utilities because they need you there. Whether it be an employer or a housing development, whatever it is, I think that's one of the keys.
Yeah, and I guess I was thinking in the context of an alliance, if you have the opportunity to offer that space rent-free, say in the context of our family childcare network, if we have family childcare providers, we could co-locate in some of the historically disadvantaged neighborhoods where we work, where we could provide those supports and almost like an incubator for those family childcare providers. I just wondered if there had been movement anywhere, but it sounds like we're really, this conversation is on the cutting edge, so maybe not.
Yeah, I mean, I think that there are pockets of things happening. Most of it is happening under the radar because the licensing issues are so squirrely, right? But I think that we're starting to see some of this. This is a huge growth opportunity for family childcare that wants to move out of their home into a non-residential space. So I'm really encouraging states that have this ability to do it. Hey, do it. Call it a micro center. Yes, it's licensed as family childcare, but move into that space.
Yeah, and I think just thinking about co-location, not as just with an employer, but also
Correct.
with another micro center.
Yeah.
Yeah.
Could be.
Hi there, I'm Crystal Johnson. I'm with Nevada with the state office administering CCDBG and very excited to see that Nevada is one of the states on there that we have that wiggle room. We have been doing many changes right now, really some pretty radical changes with really trying to redevelop our system. Having a lot of focus on capacity building for family childcare, specifically having our own challenges with that licensing piece. We've recently discovered that, we're doing this big push for recruitment, but realizing that we were the barrier to get people from home-based childcare providers that are just our registered providers to licensing is having their challenges because we were paying them so low on our rates to where they could not even, we had one provider come forward, could not even qualify for a home. We helped her fix her credit. We helped work with all of this. She was a brand new provider in 2020. And that was the only thing that she could not do because in Nevada, you cannot be a licensed childcare provider if you are in an apartment setting. So that's where there's the piece of, okay, so if I don't have to put them in an apartment, you've got my wheels turning of where can I put them? Because we have the people right now that want to be childcare providers. So it's figuring out in my mind how did you guys start with that piece of it? So if I'm looking to replicate this, which I would absolutely love to figure out a way to do this, even to start it and pilot it, when you're talking about that staff, that hub, where did that come from? Who managed that? Who set that up? Where's the best place to connect us with for the resources so that we can then model and then create something?
So
I think you look to an existing childcare provider, somebody that already understands licensing, already has the relationship with licensing and understands childcare. And that's what happened in our instance. In our instance, the school system came to us and said, we have this problem. We want to offer childcare inside of our schools, but our school system will not, liability insurance will not cover a child under the age of 3 inside of a school building. That's, I don't know, I think it's our state law. And so they could not care for children and they wanted to do it. And so they came to us and said, would you do it? Could you license it? Could you cover it? And Bill said, sure. And so, well, let's figure this out. So I think you go to somebody that already knows childcare, that already has liability insurance, where you just add another address. Because that's literally what we did on our liability insurance, is we called them up and said, we are going to operate childcare and we're only going to have 12 kids, but it's going to be at this address. So when you look at our insurance thing, we have a 2-page, addendum of every address where we operate childcare programs, but they're all covered under this one liability insurance policy. So it makes it easier for folks who are already doing childcare just to do it in a very small scale over here and over here and over here and over here.
Okay, so, and when, I guess I would need to look at our own, pieces for that, because my thought is, does that change, do the regulations change then around having that be a center who's licensed? Because those would be centers versus now we're talking home-based childcare providers. No?
No. So here's the deal. So Chambliss Center is licensed as a center. So its hub is licensed as a center.
We're licensed for 483 children at our main campus.
Okay.
And then they have individual licenses, home-based licenses for their micro center.
Under Chambliss Center for Children. So our school sites, they're on licensing paper. It says Chambliss Center for Children at Hickson Middle School, Chambliss Center for Children at Clifton Hills Elementary School. And so they are a Chambliss location, but they are at a different location, and they have different provider numbers. Like I said, so they're, and some of our sites, we have other centers, we have other family group homes. All of them are under Chambliss Center for Children. They're just licensed differently. Now, what it meant for us is that we had to make sure that we had to study up on the rules for the family group homes, because what we had operated in before was the center-based rules. And they aren't the same. But the nice thing is we knew the higher set of rules. We just had to go back and say, okay, well, you don't have to do this, which is awesome. You just have to do it this way. So now that we've been doing that for 20 years, we have some of our staff who really know those center-based rules. And then we have some of our staff who really know the family group home rules, and they are not the same, but they're close enough that somebody that knows the center-based rules just has to learn the different nuances of the family rules, and they can still do it. It's just done a little differently.
Would it work the same with like a Head Start model? So I know we have some like Head Start centers where, looking at their capacity, we have a partnership with one of the Head Start in Las Vegas that was looking at just using a similar model, even for quality, for how they would run the family childcare center. Because that's my thought, that if I could take that piece of that and then put almost like a mini Head Start in that.
Go ahead.
that
You wanna-
model.
you wanna-
Well,
Who's going to be the bad guy? About
I
that?
I don't think,
call it that. Head Start won't do it.
I was gonna say, I don't think Head Start can license a program that isn't a center or be in a center. I don't think so.
They have to be all the Head Start.
Short answer, no.
Okay.
No.
Oh, wait.
You do not want to model this on Head Start. It is a totally different, it's funded differently. The requirements are different. We're talking about a market-based childcare setting that follows market-based childcare rules.
You can still do state subsidy. I mean, our sites all are qualified to accept childcare certificates. Very few of them do, just because most of our families are teachers in our school system, so they don't qualify, but some of them do. So you can accept certificates. We have Head Start partnerships at a lot of our centers. We have no Head Start partnerships at all in our family group homes.
So when you guys set this up, did you already have like the families that were ready for placement?
There were a few families they honestly had already started doing it and then they found out they couldn't do it. So there were 3 kids that they had just found a place for. One of them was the principal's child. And the school board found out about it and they went, no, 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 you can't be taking care of these 3 kids inside of the school. We can't insure them. So they came to us and they had a few children, but as soon as we said we can take 12, it was full. And so typically the problem is not putting children in there. It's finding enough staff to have all the children in there.
I was thinking, trying to frame it around too, looking at, because we do have this opportunity right now with the funding and the flexibility with the funding, you know, setting it up where we had maybe set contracted slots. So there was some of the risk, I would say, of, you know, working with a center, maybe to come to the table and say, hey, we'll fund you if you step out and do some of this. So, but just trying to think outside of the box on ways to make that sustainable to where we can partner with them.
Where my mind is going listening to you is that it is totally possible as a state to say, I want to put out an RFP for startup for hubs that will run micro center networks. Absolutely something you could do. And we could help you think about what are the conditions for how you would select a successful hub. They need to be using automation. They need to be, you know, have the capacity to lead teaching and learning. They need, you know, absolutely. We could, but you could totally do that.
Awesome. Thank you guys so much.
Yeah, and I think the other thing that they need to be able to do, and we do this within all of our micro center sites, but you know, is that if you've never worked in maybe you've never worked in childcare, but hopefully you've taken care of children and you're just being hired to go into one of our school-based programs, is that we take them to another school-based program and they spend several days watching how it works, because it is slightly different than a childcare center. So being able to have someone that can say, okay, this is what it's supposed to look like. If we're hiring you in as the lead teacher and you've never seen this model, which most people haven't, is that they can go in and work alongside, observe, figure out how you manage the mixed age groups, which if you've worked in a childcare center, you're not managing mixed age groups. You've got 1-year-olds or you've got 2-year-olds. So man, these babies are sleeping and these kids want to play. You know, it's just, how do you manage getting them all out to the playground when you're in this school building? Because our schools do have to have, you have to have a playground. So there is an outside area where all these programs go to. Like, so just having the ability for them to see it in action and have somebody that can kind of help them understand what the model looks like, how the classroom should work is huge.
Wow, I'm envisioning a little video that we want to do with you so people can see your sites.
Yeah, that's fine. Or you can come visit. Some of you already have, but you're welcome to come visit.
I am Mary Grant from Children's Village in Philadelphia. And when you were talking about it, I thought, well, we do that already in schools for active care, but not for infant to preschool. And in Philadelphia, they used to have childcare centers in the school district, but they stopped because the reimbursement rate couldn't support the teacher's salary. So the union got rid of it. But if the way you're saying it is, if it's another organization running it, then they could continue, they could have a center, having a group, you know, up to 12 children. The one thing I was thinking of is in terms of spaces, when you have infants, at least in Philadelphia, they have to be on the first floor. I guess it depends on local licensing.
Yeah, all of our
State.
programs, I'm sorry, you can finish your.
No, I mean, like all the, you know, building codes and stuff. So you're kind of limiting where that program could be. It would have to be on the first floor.
All of our programs they have to have ground floor access, and we have to have 2 egresses within 75 feet. So that is sometimes problematic to a school building, especially older school buildings. But again, the school system wants them, the principal wants them, and they have to convert the space if necessary to be childcare appropriate. So that is not a cost that we incur. So if it needs, the other thing is that they need little potties and changing tables and sinks that a lot of those classrooms don't have. So the school system will reconfigure, outfit, whatever they need to do to that room before we bring in licensing, before we bring in the fire marshal and say, okay, is this, I mean, we do bring them in ahead of time, but then to bring them in for the approval. But, and that is one of the things I think that hinders some of our schools that want them from being able to have them. But I will say also, our school system now, when they build a new school, they automatically draw a child care center into the drawing on the first floor. So the past 3 or 4 schools that have been built all have an amazing child care program, a classroom that was drawn in with easy access to the outdoors where they have their own playground space, but it's all ground floor. And they know that now, so they know what to draw into the drawing.
Okay, so what about the food program? Is it?
All of our kids or parents pack lunch. It's too complicated with their lunch, our food, what our kids can eat, what their kids can eat. So it's just too much. We don't do CACFB at those sites. So they pack their lunches, they're labeled, they're in the refrigerator, they pull them out.
So we're actually exploring this with a provider who's typically done before care and after care, looking at kind of getting into this space. One of the questions we run into with different school systems wanting that for their own teachers, and I can see this happening with employers too, is just guaranteeing spots for certain people. So, guaranteeing, well, all 12 of these need to be for my employees, or if you have extra spots, you give it up to community members. But then you look at, if you don't have high enough enrollment, you're not making numbers. So have y'all dealt with that at all in terms of like keeping enrollment up, guaranteeing it for teachers, or do you open it up for community members? How do you deal with that enrollment question?
We have dealt with that mostly on the end of who gets to use it, not necessarily on keeping the numbers up. The way we've set it up, or what we've said, is that the employees of that school have priority. If a school only fills 10 of the spots, then we allow teachers from other schools to use it. Typically teachers who are in a school where they don't have a childcare program. So the issue we've gotten into with that is that we have told them, if somebody needs that spot from the host school, then you will lose your spot. And that has created a lot of tension because we've had their children from the school down the road, they've been in the host school for years. And then all of a sudden the host school has 3 teachers pregnant. And that principal says, this is my program and my teachers are going to need to use it. And we give them obviously a lot of notice. Pregnancy is 9 months and they know when, and you have the summertime too, to kind of, before it starts back up in August. So we've given a lot of notice, but it has created a lot of tension. Now, one of the things we have done is channel that tension into, well, let's get one for your school. And right before the pandemic, we have lots of mountains in Chattanooga, and there was one of the mountains there's 2 elementary schools. One of the schools had a program, one of the schools didn't. And a lot of the parents from school B were coming to school A, and we said, sorry, we're going to have to move 3 or 4. I forget how many of you, we're going to have to basically kick you out next year. And they were incensed. And we said, well, let's open one in your school. And so they went to their principal and they had found a space, and we were about to go down that road with them, and then the pandemic hit. And so we put that on hold. But I think it's just a way for us to continue to force the school system to meet the needs of the teachers in their school. And so we've been able to channel that energy mostly that way. Katie, I'm gonna ask the question. Oh, sure.
So, but how can you have shared enrollment activities at the hub, right? So is there a way that can help address some of this need?
Yeah, so we have shared enrollment within the school programs, not across all the sites. We've got other centers in our main campus. So when there's a Hamilton County school employee looking for care, I send them to my director of all the sites. And then she can say, how old's your child and where do you work and where do you live? And then she tries to find a spot depending on where they work or which school they work in or where they live. So there is some ability for us to find another spot, but then she also has to say, but keep in mind, this host school has priority. And so if at any point they need the spot, then you would have to move. Now, hopefully at that point, it would, they're almost guaranteed a year in the program. We don't kick kids out mid-school year. So if we enroll you in August, you've got a spot for that whole school year. So it's at least some stability for parents to know they've got that school year. And if we need to move them at the end of that school year, then we go back to that director of the school-based programs who goes, okay, where else can we find a spot for you? Or can we go push your principal to open a program at your school?
My name is Lori Nichols, and I'm with the school board chapter in Denver. And the issue, the way we've approached the micro center is driven by the community, the local municipality. Maybe that's kind of the driving culture of Colorado. But it creates a nice opportunity in that we can get rules and regulations and community suggested to get that kind of support. But we aren't able to really get the employers to take the lead. I think that's creates a different set of issues. We don't have easy access to insurance, but we are working on getting some of our spaces in public buildings to be tax exempt for the owner, which then passes it down to the less rent that has to be paid by us, the organization. And so I just wonder if anyone has any feel as to how the best way to parlay that local initiative with the municipality to something that's a little bit more broad.
Well, that's kind of a great Tennessee question, because that's very much what you're trying to do in Tennessee, right? You've got some statewide leadership, and yet you're creating regional groups that are going to come together, that are going to figure out how would we implement shared services in our region to leverage what's available locally, to identify local leadership. So it's sort of like a top-down, bottom-up approach. I don't know if anybody from Tennessee wants to talk about, or do you want to talk from the, I mean, you're involved in that. I don't know. It's very nascent. It's very new.
Yeah, I mean, Tennessee is looking at it, and we haven't really taken that first step. But I think, I think that the power of the state, and actually, this is actually our state. It's DHS. It's our licensing entity that's saying we want to push this micro center model, and so. For us, we're in a good position, because if we have issues with it, they're the ones that want us to do it. So I think your situation, it might be a little bit different, because you're looking for employers to step up. Is that what you're, yeah. Mm-hmm. Yeah, I'm not, I think employers need to understand. And I think that this pandemic has probably helped them understand a lot the importance of childcare to their workforce. So I think our Chamber of Commerce has been really successful and helpful in this, is to talk about how important childcare is to providing workers. And so I think that if they understand, hopefully they do, that if they don't have stable quality childcare for their employees to use, then they don't have workers, especially willing to come back to the office. I know that's one of the things employers are really trying to do, is to try and lure people back in. I think having on-site childcare is a great way to do that. So I think a lot of it is education to the employers, and if they don't already know how important childcare is, then I would say your Chamber of Commerce and others would potentially be helpful in that area.
Yeah, I just want to chime in there. The foundation of the Chamber of Commerce, which is it sits at a national level, has been working with the individual chambers across the country. This is a very important sector topic for them. And so they're also trying to figure out how to sort of generate activity and work at those levels.
Yeah, I think it's really important to create, I think it's really important to create a pitch for employers Like, here's the role that you can play. It goes back to what I said to Shannon before. I think employers will give us free space. I think employers will give us coverage for like a lot of those facilities costs if we come to them with a package and say, look what we got for you. We're going to take care of all these other things. But you will then be able to have a childcare opportunity in your workspace. So I think part of this is us getting really clear on what are we offering you? What are we going to take responsibility for as micro center hubs? How are we going to deal with licensing? And then what's the role of the local employer?
I'm Sherry, and I'm from Indiana, and I'm a coalition leader that's actually housed in the Chamber of Commerce. So we've had some great success in connecting with businesses. And I'm actually having businesses come to me and say, what are some solutions? How can we do this on site? Nobody wants to build a large on-site childcare, but we're looking at more creative solutions. And we recently, well, a year ago, had a business that wanted to purchase a home and have operate a licensed childcare home. So it would be an unoccupied house. They didn't want to do it themselves. They brought in some experts in the community that already ran 2 level 4 childcare centers. But our biggest problem was zoning, an unoccupied house. And we actually had to go to our city and county zoning boards and change some zoning laws. So it seems like every time we're trying to break down barriers and expand, we run into, and then the health department said, oh, it's a house. So it's a house, so your well has to be 100 feet from your septic. And so it was it took a year for them to actually find a house in the right residential area that worked. So we want to continue to build on this, but it takes the whole community and zoning and licensing to get this done. It's not without so many jobs.
Bevin, somebody from the internet asked about low-income housing and shelters. Have you gotten some folks like that who are looking at micro centers?
Through both the LIHTC deals. So we have low-income housing tax credits that are available for affordable housing. And one piece of this, I mean, these are really competitive tax credits. I'm not going to get into the nuance of the percentage and all these things, but you know, they sort of get offered up annually. Developers apply for them, they receive them. It can be a subsidy used within the capital stack. What we push for and what some states have included in the application is high priority for a community service or a social service to be integrated within the context of the development, right? And so now we have some movement, I think, again, towards sort of pushing for this. I mean, this is some federal policy that that LISC and others, you know, really push towards, is to say, like, let's make sure childcare is a high priority. It gives you extra points to think about the consideration of this. So there's sort of the context of having a center like within the affordable housing, but we're also running into some issues where we have family childcare or home-based operators as residents within these sort of developments. And we see in certain communities that that's not an allowable sort of use of the space. So we really, again, that's another sort of policy point and lever that we've been really trying to push, is to sort of expand the ability to do these things. And I think people are listening. We have so many more sort of work at home entrepreneurs where you can't really just restrict having a sole proprietor business within an affordable housing. There's so much sort of to unpack there, and we can't just keep doing that. So those are certainly some pieces that I know CDFIs and others within the community, you know, we really have to think about the economic development and sort of community development context of some of this, because there are people willing to listen. And if we hear from childcare advocates sort of like a little louder on this, or at least, you know, towards the right audience, I think we can get some movement. There are people interested.
Okay.
No, they can't hear you on Zoom if you don't speak in. Yeah.
I'm normally fine with my voice. So I just wanted to respond to you, Louise. You talked about working with businesses in this market where employers are having a difficult time finding people. There's your selling point.
Yeah.
This is a perk of working for us.
Yeah.
Same for school districts. shortage of teachers. And if that school says we offer on-site childcare, they're gonna go work at that school versus the one that doesn't have it.
Yeah.
So I think it is really a workforce perk that you could sell to employers, you know, whether it's county government, school districts, whatever. And school districts, and it, you know, it depends on the states and taxes and stuff like that, but often they have capital improvement funds that they can make those changes, and it's an easy thing for them to do if they want to do it. And if you can convince them that they're going to get teachers because of it, or they're going to get employees because of it, they will find a way to do it.
Yeah, I totally agree. And I think we have a great opportunity right now with employers begging folks to come work there with sign-on bonuses and all sorts of things. I mean, if you think about it, this is a way to recruit people without having to pay them, you know, $10 an hour more than you were paying them before the pandemic. I mean, cost-wise, it's a huge benefit they can offer to their potential employees without the same kind of cost to the company. So I think you're right. I think this is a great time to be talking to employers. One, because they probably have unused space that they might have used for something before the pandemic that they could convert to childcare, but two, because they really, really need workers. And, you know, desperation will cause you to do lots of things. And if it makes you build a childcare program, then great.
So it just occurred to me that with your comment, and this is kind of specific to having these micro centers within a school, is there friction between the salaries that the teachers in the micro center are making versus the salaries that the teachers, the parents are making? And is that, you know, it just seems like it really highlights and could potentially highlight that, you know, gap. And I know that childcare programs are having a lot of difficulty also recruiting staff, in addition to other employers. And so I think it just sort of highlights this whole compensation conversation we were having earlier. And I'm just wondering if you see that, if that ever sort of crops up in your programs.
It hasn't cropped up. There hasn't been any direct tension that I will say, but I think that we are going to have a hard conversation when I told you about how we're going to have these floors. We're going to have a hard conversation because teachers all the time are saying we're not valued, we're not paid enough. And then they're not willing to pay our staff enough. And so we're going to have the conversation about valuing them, paying them a professional wage. Is that what Ryan was calling it? And so it really hasn't been that much of an issue to date, but we're seeing it now with not the tension. We're seeing issues with what they're being paid with the staffing shortages. I've got a couple sites that aren't even open right now because they didn't have enough staff to be open. So we're going to have that conversation, but it really hasn't been any conflict, I guess, between the staff in our program and the parents, other than just the parents don't want to, you know. I mean, yeah.
Again, that's not fair.
Yeah. Yeah.
A point of clarification, though, which is kind of interesting. So the way that they run the micro centers at Chambliss Center is that each one of the micro centers is like a little parent co-op. So each one of the micro centers has a parent advisory board. That parent advisory board sees the budget. That parent advisory board makes guidance on what rates they're going to charge and therefore what they're paying the teachers. And this is what Katie is saying, like we need to kind of rein that in and put parameters around what choices those advisory boards make. But, you know, this is a learning process. Yeah. And I think one of the reasons, and I'll put words in your mouth, you tell me if I did it right, is that one of the reasons why they structured this with the parent co-ops is that these are mixed age groups. So if you have a group of parents and most of them have babies, the cost of care for everyone is going to be higher than if you have a group of parents and they all have 3 and 4-year-olds, right? So that's part of the reason, the nuances behind this. But I think what Katie's saying is, as an organization, they want to put more parameters. Now, let me just say one more thing, which is you don't have to structure it as a co-op. You can just say, we have micro centers. Our micro centers are an extension of our hub. These are the wages our teachers are paid, and this is the price for that private fee paying families pay. And this is what so it's just so happens that they structured them that way. Doesn't mean that the micro center model has to be that way.
Yeah, and we didn't set out to have a bunch of micro centers. So that this wasn't set out to be scaled. It was set up because I was like, yeah, sure, we can do that. And then another school came along. He's like, yeah, sure, y'all can do that how you want to do it, you know? And so it was really set up to be this group of parents wants to do this, and this is how, and we're just going to help them do that. And then this group of parents wants to do this, but it's a little different than this group. So let's let them do it this way. And what has happened over 2 decades of doing this is that we have 12 different programs. They all function 12 different ways. And the teacher liaison at every school has a little less or a little more responsibility. And the lead teacher does it this way at this school, but the lead teacher does it this way at that school. And that's what we're going to be working this summer on, really just kind of getting some formalization around that and some uniformity, so that it is going to be, one, much easier to replicate, but also two, just much easier for us to manage now that we're at a scale where we've got this new site.
And I just want to say, I'm fully supportive of people thinking about this as a way to serve both private pay families and subsidy families, right?
Yeah.
And so if we're thinking about the cost modeling up front, let's figure out a way to integrate those slots within the work. It can be done, right?
Absolutely.
I mean, might have answered my question just a second ago. Mandy Kimball with Children at Risk in Texas. Welcome, out of towners. And I oversee our public policy and government affairs, and I'm not with my colleagues who they might be able to answer this question. Please excuse my ignorance, but why is it exactly family group centers, or is that just what you started off with and continue doing? Because it seems in my mind, both, and I like the RFP idea, and then I instantly went to licensing, which can be tricky. And is the target on this and is there a reason why it's on family group care of when we're trying to look for exceptions, or could it be center care? Because you have the hub and then you still have micro centers.
So we've got 3 different licenses in Tennessee, and every state's going to have this differently, but we've got the family child care home, which is up to 7 children. I think that's right, 6 or 7. And then we have the family group home, which is up to 12. And then anything after 12 is a center, like anything above 12. So we actually have a school that has a large enough space that they can have 15 children in there. So we tried to license them as a center, and it's not going well, because the program itself is going fine. I just mean on the licensing side, it's not going well. Because the licensing counselors want it to act like a childcare center, which does not support mixed age groups. So what they want us to do is have permanent divisions within the room and have the infants in this area and the toddlers here, and so it doesn't work that way with staffing. So staffing is different, the space becomes different. There's no way for us to continue operating as a childcare center if they're going to really enforce the childcare center rules, which the old licensing counselor wasn't, and now we have a new licensing counselor, and they want us to actually be run like a center.
And that's what I was trying to figure out, but it's kind of like, where's your pressure point? Because on the other end, you might have to be asking for them if it's a family group home setting. Well, it's not a home.
That's
Right?
just the name of the licensing category for us, but it doesn't have to be in a home. It allows us to operate a small center, not in a residential setting, and that it's what allows us to operate this like one room mixed age group, not in a residential setting.
So your question speaks right to the heart of the messiness of this issue and the importance of our leadership. So the reality is there are thousands and thousands of childcare programs in the United States that do not fit into any licensing category. And so we have 2 choices, and we have to do both. Number one, we have to change our licensing so that we create room for these small settings, because they're neither fish nor fowl. They're not a center, they're not a family childcare home, they're right in between, and we don't have any rules for them. So you want to make those changes, but I'm an impatient person and it's going to take years to make those changes. So while we're making those changes, let's figure out how we can do it anyway. And this is how they do it anyway. They call them group family childcare. We know that's a stupid name. That's not what they are. But hey, it passes muster with licensing. They can do it. And meanwhile, the rest of us are going to start messaging. That's why she says we had no idea it was we're inventing micro centers, just like we invented shared services. And we're going to actually change the law ultimately so that we can have micro centers. But that's going to take a long time. And let's not wait. Let's just do it while we're redefining it.
Once, and then after that, you say, well, we did it over here.
Yeah, there you go.
And
Yeah.
then they go, oh, okay, you did. Okay.
But it sounds like an articulation of these pressure points is an important thing, so we can sort of understand how to navigate between what we have existing in terms of licensing. I'm just looking at time. This is so great. I think we only have time for maybe one. maybe
Yeah,
two
we
questions.
really.
She's had her hand up over and over and over.
Come up here to the front.
But we can keep this conversation going, guys. Like, just keep talking about it. We just not in this room.
Thank you. I'm interested to hear, for all of you, what do we need to do to build a coalition to make a long-term change to licensing? What would be your top suggestions? And then also, if you have suggestions for the short term, trying this out, looking from the state where the licensing rules are not.
Yeah.
allowing this.
Yeah. So
Sounds like a great closing question.
that's perfect closing question. So, and we should actually ask each one of us to give, I'll start, but you guys should chime in. So I think number one, we need to start creating a clear set of definitions. Here's what a micro center is. Here's what it would look like when you run it. And here's what needs to change in licensing for that to happen. And then if you happen to be lucky in a state where you can license them as group or family childcare, go for it. If you're in a state that doesn't, I'm going to tell you something. Social service commissioners have the authority to waive every single rule. They have the authority. I would go to them and I would say, we would like a waiver to test this new idea. We will evaluate it. You can come in and do class assessments, come in and do air. We're good with it. Study us up the wazoo. Just give us permission to break the rules for a short period of time to try this totally innovative national new model that's, won an award in Colorado that actually never got off the ground because of COVID, but we run an innovations prize to try it, right? So let's just talk it up and try to get permission to break the rules.
I would say there's another way to do it, and that's just to convince your licensing people to help you do it. And this is probably not, I'm trying to be recorded because now that I can go back and say it, but I don't know about your states, but in our state, there's a lot of interpretation on a lot of things. And one licensing, we have a lot of sites, so we have a lot of licensing counselors, and some of them say you do it this way, and some of them look at the same rule and say you do it that way. And so I think there is a lot of ability to do things depending on who you ask the question to. And so, one of our favorite tactics is to ask a licensing counselor to help us figure it out and figure out how we can do this. And then they end up becoming part of solving the problem with us instead of them being in the regulatory space, that they become, a partner with us in trying to figure out how we can provide quality care to children in a slightly different setting. So I would just encourage you, if you don't have those relationships, to find somebody who has those relationships or to start making those relationships. Because I think that we have had the ability to do some of what we have done because one, they know who we are, and we go to them and say, hey, this is what we want to do. Can you help us figure it out? And then they do.
So in addition to the great thing that everybody else said, I would say the cost modeling piece of this is critical, right? So let's think about this. You grew organically, right? And so there was no time up front to sort of say, this is how it's going to roll out over time, right? And so, but that's great. And it's great best practice. If we can sort of think about upfront what we can do. So how can we get ahead of the compensation issue? How can we get ahead of ensuring that it's private pay plus subsidy families, right? How can we get ahead of some of these pieces? What is that critical mass number that we need to be participating within this? And what is the upfront differential, right? Because all these things are not going to open on day one at 100% enrollment. So is it 12 months that we need? Is it 2 years that we need? How do we get employers to buy into that differential? How do we get local communities, philanthropy? I mean, this sounds like so many things that public-private partnership can really support, particularly if we've modeled the costs upfront. We say at the end of the day, this is how many kids we're going to serve. This is how many kids, low-income kids can be in there. This is how employers are going to respond, right? And so like, let's think about these contextually and almost map out the impact and the outcomes that we can have, right?
Great. Thank you guys for coming. We'll keep this conversation going and we'll see you in the next session.